So let's look at these other causes of altered mental status. Primarily, the big two are seizures and stroke that we'll be talking about. When we look at the seizure disorder, anybody in here have a seizure disorder? No? Nobody's going to seize on me? Okay. So when we look at having a seizure, that was quick. What we look at is in the brain sends out neurons to make the muscles contract, make everything else work. These neurotransmitters get together, they start communicating, right? And the body does that at a certain rate. And these neurons, all neurons fire at a certain rate. When they start to discharge not at that rate, or at a chaotic rate, what takes place is a seizure. Any one of us right now could have a seizure. It's just a matter of getting those neurons out of order. They've flashing lights, video games, the cartoons now that they have all been linked to people having seizures. Most of us won't have a seizure, but there still stems that possibility. The best explanation I can come up with to think about these neurons firing and they're in a certain rate, everybody remembers the cartoon is ants, right? Was it ants? No, the one with Hopper, the grasshopper.
Bug's Life?
Bug's Life, yeah, that's right. Everybody remembers Bug's Life. That's the title. So remember, in Bug's Life, all the ants have they're carrying their food to the big pile of food, right? And they're all in line. Because they don't feed Hopper, and they're carrying the little food, and they're stacking it on top, and all the lines, all the ants are in order. Then that ant is always causing the problem, does something, right? He does something with his leaf, and it drops off, and the leaf drops on the herd of ants that are all in line. What do the ants do? They panic, they go different directions, they go all over the place, right? And there's that one guy with the white hat on, the one ant that's in charge with the white hat on, that's going, oh, it's okay, get together, back in line, we'll go around the leaf. So he puts everything back in order. Well, that's what he sent, and then they get back in order, and everything looks the same, right? And then they bash that one ant that caused the problem. But that's what the body essentially does when these neurons get out of sync. And it takes the body a while to get the neurons back into sync. Right? They have to fire in a certain order. Diabetes, like we learned, can cause seizures. You could have epilepsy, which is still sort of unknown. That causes, and there's multiple levels of epilepsy. You can have seizures from trauma, seizures from alcohol toxicity, seizures from drug ingestion. When most druggies start having seizures, that's when they're at their point of death. So drug-induced seizures are life-threatening. So there's multiple different reasons to have the seizures. However, the treatment's very common on all seizures, on all tonic-clonic or grand mal, M-A-L, grand mal seizures, not grand mal, but grand mal seizures, and or tonic-clonic. The treatment's the same. So when we look at this, because tonic-clonic is the biggest category of seizures. They have a full body where the body is jerking and shaking. And it's not like a fish. Like if we took the little flipper out and threw him on the thing, he would flop all over the table, right? It's not like that. When someone's having a seizure, they draw up. They actually, what's called posturing, they draw up or they push out. So they have what's called decorticate posturing, where they draw in, or decerbate posturing, where they go out like this. Right? So it's not a flopping type of thing. But you do get, in the tonic phase, very rigid, and then the clonic phase with the jerking. Most seizures last between 1 and 2 minutes. They seize, they go in, then after the seizure, they go into this postictal phase or sort of a recovery phase. If they're breathing at all in a tonic-clonic seizure, they're not breathing very well. So you got some hypoxic issues there. So they need time to reoxygenate, which would lead you to think of what's the primary treatment for someone having a seizure or postictal. Oxygen, right? Give them oxygen. Yeah, you put a mask on there. It's okay. Some seizures lasting longer than a couple minutes, you may actually have to bag the patient. What kind of airway would you use? If you had to utilize an airway, let's say the seizure's lasting 5 minutes, and now you've got to bag the patient. They're becoming cyanotic. So what kind of airway? Yeah, why the nasal, not the oral airway? Right? When they seize, they clench together. That's why we don't put our fingers in the mouth, right, of any unconscious person, because cerebral hypoxia can cause seizures. So if they've been hypoxic, you put your fingers in their mouth for some weird reason, they'll bite your finger off. You come up like that. Then you have an airway obstruction, right? So put a nasal airway in and start bagging the patient if the seizure is lasting more than a couple of minutes. The postictal, what a weird word, huh? This postictal phase can last 30, 40 minutes. And it's a recovery type phase. I've seen them where they were just, their eyes are open, they seem like they're alert, but they can't say a word. They're just sort of looking at you. And they can't answer your questions. They're just in that postictal phase. So you put a non-rebreather on them, let them breathe in some oxygen, let them recover. All right? Most of the time in a tonic-clonic seizure, they're going to be very diaphoretic, very pale. All right? A lot of times most every time in a true tonic-clonic seizure, they lose their bladder control, so they urinate on themselves. But here's the tricky part about the seizure is, someone with that history of seizures, a lot of times they will seize and not go to the hospital. Because they think, oh, I'm off my meds, or I'm not, haven't taken my meds in a while, or maybe my levels are messed up. Maybe they need to adjust my levels on the medication. So a lot of times, like diabetics, those guys will not go to the hospital. They're seized, they'll get out of their postictal state and refuse transport. Now you want to be cautious. Someone just seized, if you're at a mall or something, a store, you wouldn't want these guys to drive. And most people with seizure disorders can't drive anyway. It's against the law. So everybody good with tonic-clonic, the jerking phase, the postictal? Questions there? Right. When most people have these tonic-clonic seizures, they get a sensation that they're about to seize. So what I would do, if I started getting this sensation like, oh, I'm going to seize, I would lay down this soft mat, and then you'd seize. Your part would be not to allow a bystander to stick something in my mouth, because they still think we can swallow our tongues, okay? It's not to hold me down, or not letting the bystanders hold me down. Because you got to remember, all these neurons are firing, and all these muscles are contracting. So when you start holding them down, you could actually break bones doing that.
I have a question. You said you're not supposed to put anything in your mouth. But my uncle, he does have that, and they stick a rag in his mouth because he bites his tongue.
Oh.
So is that okay?
A rag won't hurt anything, because once you don't, but you still, the canned response is don't put anything in their mouth, because anything in their mouth can become an airway obstruction. He can swallow the towel with the rag, and it can block his airway. All of them bite their tongues and bite the inside of their jaws. That's one sign. I'm glad you brought that up. That's one sign that they did have a seizure. Most all of them bite their tongue or jaw. To me, I would never put anything in their mouth, because it will become a potential airway obstruction.
So then I should tell them to stop.
Yeah, stop doing that. Don't try to shove anything in their mouth. They could suck that towel down and become an airway obstruction and block their airway. So I wouldn't do that. They may smell something, a sound, or something just right before it, and then a lot of them will lay down or sit down, have their seizure. While the patient is seizing, just remember not to hold them down. You can go ahead and put oxygen on them. If you think that they're, if they're becoming cyanotic, you can start putting a nasal airway in and start bagging them. All right? And then, but just protect their spine and their airway. Let them seize. They're going to seize. And then a minute or so, 2 minutes, probably at the most, they'll stop seizing, go in this postictal state. Still hyperoxygenate them, keep a non-rebreather on them. If they don't seem like they're breathing well, breathe for them. And then eventually they will work out of this postictal state. And that's the only thing really you can do. Protect. Really the big thing is protecting them from other people. I've seen people seizing and someone would lay across them. It's like...
I think you told us about that story.
Yeah, here.
Yeah.
It's like, get off of them. What are you doing? Oh, I need to hold her still. No, you don't. You don't break bones. Get off of her. In your fat, so get off. You're hurting her anyway. I didn't say that. I just thought that. Okay, and for them, a person with a history of seizures, it's not a big event. Now, the big event comes, I have no history of seizures. Never had a seizure. Okay? If I have a seizure and I have no history of seizures, that's a big event. I need to go to the hospital, get my head CT'd, figure out why I had that seizure. Makes no sense I had a seizure. Anybody involved in trauma that has a seizure due to the trauma is a big event. They need to go to a level 1 hospital, figure out, because now they got a neurological dysfunction taking place that's completely abnormal for them. Someone that has a history of seizure, they get involved in a trauma event, have a seizure, not the same huge event because they have a history of seizures. You still have to be cautious, but not as big as someone who's never had a seizure before, especially a tonic-clonic seizure. Everybody good with that? So they're having a seizure, they're having tonic-clonic seizure. Time you get there, EMS-wise, they're probably already done. They're in the postictal state, or they're faking it. People fake seizures all the time. Why do people fake seizures? Any idea?
Didn't you say they do it like to get out of pain or the meal?
Yeah, a lot of them will fake it in the restaurant, get out of from pain in their meal. The majority of them, well, some of them seize, husband-wife fight. I've seen this forever. Or teenager almost seize because I'm taking my report card home and it's on the table. Mom picks up the report card and goes, and all of a sudden the raft of mom turns around and the kid goes, okay, and starts having this little seizure. Well, mom's not worried about the grades anymore. She's worried about her precious little daughter having this seizure. Okay? And they just don't know how to fake it very well. Now, the good ones, they want the drugs. Because the ALS treatment for seizure is a benzodiazepine, which will make you really high. So they want the drugs. So they'll fake a seizure with the drugs. Now, there's a couple things that you can't do during a tonic-clonic seizure. One is you can't speak. No verbal commands. You have a Glasgow of 3. All right? The second thing is you can't follow commands. So, first thing I do, I see someone seizing, and after you've seen a few seizures, you know that they're faking. So I go up to them, and I get real close to them, I say, "Are you seizing?" And it makes them, because their eyes are shut and they're doing this, right? And so it startles them and it makes them stop for a second. Now the rookies will look at me, I'll ask them that, they'll open their eyes and go, "Yeah!" I'm like, "You idiot, get up." Game's over. Or ask them to follow some simple command. When I'm about to start an IV, I have their arm out like this and they're doing this. And I say, "I'm about to start an IV." And they stop shaking that arm that I'm about to stick them in. and just shake like this. You know, all kinds of weird things. I've seen them urinate on themselves before. All sorts of things faking these seizures. But, you know, treat them like a seizure. Treat them like they're having a seizure. Ask them questions. If they don't respond, you know, if they respond during this tonic-clonic phase, they're not having a real seizure.
So you don't have to wait until the post-stage to like give them IV or oxygen?
No. You can do that during the seizure. Right. Paramedics hit veins easier moving anyway, the way we're taught. But no, go ahead and put the oxygen on them during the seizure. Huh? No, non-rebreather. It doesn't go in their mouth. Just put the face mask over the face, yeah. All right. Now, a partial or a petit mal seizure, non-tonic-clonic, means they don't have the stiffness or jerking. Is they just have this uncontrollable muscle activity. A lot of people get confused with Parkinson's. They shake, you know, or they might have a little twitch or something. And it's a petit mal or a partial seizure. They can communicate with you. But these seizures can last for hours. I've picked up people that have, this seizure's lasted for 8 hours. I've been doing this for 8 hours. I can't get it to stop. I've done everything. So yeah, those guys need some medicine. But that's the difference between them. They're having, like it says here, a little muscle spasm or a small convulsions, but they have a history of petit mal seizures. And they might just be sitting here doing this and shaking their hands or something, and or staring off into space. That's sort of a petit mal type seizure. So they can respond to you there. That's different than a tonic-clonic seizure. Oxygen probably won't do these guys any good. All right? Most of the time, you won't even come in contact with them because they won't call 911. They will call somebody and have them take them to the hospital because they're so used to having these long, drawn-out petit mal seizures. Okay? Really, petit mal or partial seizure, a non-life-threatening event. And they still have to get it stopped, right? So they'll give them some drugs and they'll stop the seizure activity. Now, the interesting note here on a tonic-clonic seizure is the medication that they give them, ALS-wise, you know, the benzodiazepine, stops the muscle activity, but it doesn't stop the seizure. It just stops the twitching, the convulsion. The seizure, as far as the neurons firing and everything, is still taking place. You just don't see it because you've stopped with life through pharmacology. You've stopped the twitching part of it. You can see it in the heart rate, actually. Once you stop, if they're still having the seizure, the heart rate will probably still be up. So we look at the causes: hypoxia, big one, stroke. Talk about that next class. Some kind of a brain injury, different toxins that you breathe in. You can have a seizure. You know, you get poisons, eat certain poisons, inhale certain poisons. Hypoglycemia, we spoke of that last time. That can cause seizures. Tumors, infection, big time infection. You can have a medical heat stroke. Heat stroke is when the body temperature becomes greater than 105. So you can have someone that is septic, temperature's way up there. They can start seizing from that. Those are life-threatening. Idiopathic means that they don't know why. Idio or idiot, they don't know why. That's how that word forms out. Idiot is something, ignorance is not a bad word, right? Let's say you're ignorant of this. Why are you ignorant? That's just a word saying that you don't know. I'm very ignorant when it becomes to anything trying to fix anything. Like, I know how the engine works, but I'm very ignorant when it comes to actually fixing it. I don't know how. Okay? I'm very ignorant in math. I don't know a lot of math. So see, the word's not bad, really. It's just if you use it in the right definition. Instead of like most people, "Oh, you idiot," you know, that's the bad part. That's the bad way to use the word. So idiopathic, they don't know. Epilepsy, they still don't know a lot of causes of epilepsy. And there's multiple different types that we don't really have to go into because tonic-clonic, they all have tonic-clonic seizures, and the treatment's all the same for us. Protect them, protect their spine, give them high concentration of oxygen, support their airway. They may need suctioning. They may need a nasal airway. They may need a bag valve mask. Okay? When you see multiple people seizing at the same time on the same scene, that is a big red flag. That means something, a toxin is in the air. That would make an unsafe scene. You get a call saying there's 5 people seizing at Horn High School in G103. Well, they're going to send somebody else in there to figure out, in suits, and figure out why everybody's seizing in there. Could be chemicals, okay? So that, for us, would be an unsafe scene. Right before this, if you're there before they start seizing, they'll tell you, people with history of seizures, they will tell you that they feel like they're about to have a seizure. All right? We've already talked about, what were they doing when they seized? You know, you're trying to figure out assessment questions. What were they doing when they seized? How long did they seize? These are questions that you're asking witnesses. The person who's actually seizing, you say, did you have a seizure? And they will say, I must have. I'm on the ground and you're here and I wet my pants. Or I don't remember. The person having the seizure won't remember the event. They'll say, yeah, I remember, I think I was about to have a seizure and I lay down, but I don't remember how long. I don't know how long. That's the information that you have to get from the other people. And then what do they do after the seizure is very important because everybody that has a tonic-clonic seizure has a period of a post-ictal time. You don't have a tonic-clonic seizure, seize for 5 minutes or 3 minutes, and then get up and start eating your bluebell again. There's a period of post-ictal there for every tonic-clonic seizure. That's real. That's how one reason that you know that they're fake is there's no post-ictal time. They went from seizing to doing this without any recovery time. I've just never seen it, except in the people who are faking it. So place them on the ground, loosen up clothing, protect them from harm, like we talked about. Protect their spine, their C-spine. Don't let their head hit the ground, multiple times. Hold their head gently. Don't put anything in their mouth. And still do the same thing at the end. You always provide oxygen. Make sure that their airway's open. Put them on a non-rebreather and let them get that post-ictal time out of the way. Like I said, it only lasts 1 to 3 minutes. I wouldn't do nasal cannula, but I would always do a non-rebreather. They need a higher supplement of oxygen. All right, so, everybody good there? Any questions on seizures? Oh, one more thing, and we'll get a break in. Status epilepticus is 2 or more seizures lasting. So same way with status asthmaticus with an asthma attack. Okay, so when you have this, you have patient seizes, stops for a very, very short amount of time, then seizes again, stops for a very short amount of time and seizes again. So one after another seizure. This is a life-threatening event. You need to put an airway in them, start bagging them. All right, high priority because they need medicine that you can't give as an EMT to stop the seizure. So status epilepticus is one seizure after another without ever regaining consciousness. And usually they're back to back. All right, let's take our break.